Great. And today we have Paula Esquilberto, who's the president and CEO of the United Way of Central and Northeastern Connecticut, and John Prescott here from the Community Investment. He's the Community Investment Senior Manager. He's from the United Way of Central and Northeastern Connecticut. Welcome to both of you.
Thank you for having us.
Yeah,
yes, absolutely.
So I've been reading up a lot about the United Way since we booked this interview, and I didn't realize that you guys have actually been a part of this community for 95 years.
Yes, we were formed in 1924, and we were planning on celebrating formally our 95th anniversary in April. So unfortunately, the COVID-19 had another thought, so we weren't able to gather together. Nonetheless, we've been part of this community for 95 years. We have been through an awful lot, as has the community. So we've weathered a lot of challenges and a lot of times of uncertainty. And we want folks to know that your local United Way is here. You know, our job is to bring together the people, the resources, the organizations that all go to supporting local children and families. And Jenny, and I know you can appreciate that now is a time when we all need to come together.
Yeah, absolutely. And of course, on their website, Meech, it says that they fight for the health, education, and financial stability of every person in the community, which I just absolutely love. Why was it so exciting for you to be a part of the United Way, John?
Well, little background, I came from actually a partner agency named Connecticut's, and I wanted to have the opportunity to have kind of a larger reach in terms of how I was able to positively impact the community. And being a partner agency with United Way, I got to know them very well, got to know how they work and the difference that they were making in the community on a national and international scale. So that's something that I wanted to be a part of.
And what about you, Paula? Why was it so exciting for you to be a part of this?
Gosh, my career has been in the nonprofit sector, and I used to work at the American Red Cross, and that was a formal introduction to United Way. But when I was growing up, both of my parents were contributors. My father was a custodian. He worked in the New Britain school system, and we always knew it was United Way campaign time. He would come home and just tell us how much of an honor it was that, you know, even he, as a janitor, had something to give, and it was just something that was instilled in us when we were kids.
Wow, that's
amazing.
Yeah. So, Michi, I know you had a question because I know you're excited about the fact that they just redid their website a little bit, right?
Right. So I know that you guys have some new portions on your website specifically for this COVID-19 for the emergency response.
Yeah, we wanted to make things easy for people, you know, so again, as your local United Way, our job is here to make sure that if you need help, you get help.
Okay.
And we also know that now is a time when a lot of people want to help. And so we wanted to make that easy as well. And there's a need for resources, for information. So when you go to our website, which is unitedwayinc.org, right in the middle, there are 3 buttons. So you can give help, click there, you can get help, and there's a variety of resources. And if you just want even more information about the virus and things that are available to people as a result.
Amazing.
And you are also talking on there about financial strain. I mean, a lot of families are under a lot of financial strain. So do you care to elaborate on that there, John?
So yeah, we're seeing, obviously, these are unprecedented times, and it's what we call the new normal. And so we're seeing families that are losing either jobs or they're losing wages because of this. We're seeing families that have had to step away from being gainfully employed because of lack of childcare with the school systems having shut down. So all of this is putting a significant strain on our families. And as we know, communities of color are already dealing with disparity in terms of economics and access to resources. So this has just kind of exacerbated those situations. And so we're seeing our families are trying to figure out, you know, as the old saying, how to make $1 out of 15 cents. And so they're trying to work around the new dynamic, trying to figure out, you know, if you're essential staff, how do you get into work and make sure that your children are taken care of? And so we're working as your United Way to help alleviate some of these and working with all the partners in the community. And we have these different initiatives in place to try and help our families navigate through these difficult times.
Yeah, so many people have been laid off and furloughed as well. And it's just been, it's devastating.
Yeah, it is. And, before COVID-19 came into being, it wasn't as though a lot of people were doing well, right? So
Right.
statewide, 4 out of 10 families were already struggling to make ends meet. So their income wasn't keeping pace with the cost of living. But when you take a look at Hartford itself, the city of Hartford, before COVID-19, 3 out of every 4 households were not getting by financially.
Oh,
And what that
wow.
means is that they're making really tough choices, horrible choices, Jenny. They're deciding whether they're going to be putting food on the table, or are they paying their rent or their utilities? Making decisions. Can they afford for their children to go to quality early childhood education? Are they accessing good health services? Do they have the means to do that? So while we don't have the data, while the data is not in, we know if that was the situation before COVID-19, and now, to John's point, you have people who have reduced income. They've been furloughed, people are being laid off, and what we're finding is that it's disproportionately affecting women and people of color, because more often than not, you think about the jobs in retail, think about the jobs in restaurants, in bars, in the service industry, in hotels, etc. And by and large, these are positions that are held by women and women of color and men of color. So it's having just this really harsh effect on people that were already struggling to begin with.
Right. And I'm also just bringing up, I can't imagine folks going back to work or having to start over next week. And then again, you brought up this really great point, John, that there's kids at home.
Mm-hmm.
Right.
That's
Yeah,
really,
John
yeah.
can speak to that firsthand, by the way.
I'm sure. Yeah. You did say you have some kids, right, John?
Yeah, they're hiding away during the interview
They
right now.
are? How old are they?
So my daughter is 5; she'll be 6 soon, and my son is 4, and he'll be 5 in October.
Yeah. You have little ones. You need childcare.
Yeah. Well, you know
Yeah.
what? The good thing is, my wife is at home because she works for the school system.
Okay.
So she's able to stay at home and work, as a lot of the employees at United Way have. But to your point, those people that are considered essential workers, a lot of times they don't have this option. It's, I have to go in or I may lose my job.
Right.
And as Paula was saying, these are very difficult decisions that have to be made about, going out and bringing income home, or, you're looking at, am I putting myself in a situation where I could be risking my health?
Right. And also a lot of jobs right now are putting folks in a position where they have to either go back to work, or it looks like they're quitting. That's how these companies are putting it. Like, you're either coming back or you're saying you don't want to work for us anymore.
Right. So as you can imagine, it's just putting families in a horrible position. And the extent to which we can help ease that, that's what we want to do.
So I know that you have 2 funds that have been set up, Paula. Mm-hmm. Talk to me a little bit about those funds.
So one fund is local, and that was established by our United Way. It's called Neighbors in Need, and it's our disaster relief fund that we activate whenever there is a local disaster. The last time we activated this fund was when we had several individuals and families coming from Puerto Rico and other areas that were affected by Hurricane Maria. And we knew that school systems and nonprofit organizations needed some additional resources to serve the children and families. Now we're using those funds for local families to help them buy food, to pay their rent, to pay utilities, to do all of the essentials. So Neighbors in Need is strictly a local fund. It's going to help our nonprofit organizations that are on the front line serving people and helping to meet their basic needs. So we're channeling the funds through to the nonprofit agencies. The second fund, however, is statewide, and that fund is a partnership with all of the United Ways in the state of Connecticut. We've raised significant dollars, and with those funds, we're partnering with a company that sets up a virtual credit card through your mobile phone.
Oh, wow.
So it's a preloaded card, and it's being preloaded with $200. And individuals who are accessing those are being referred by city and town social service departments because they're on the front line along with our nonprofit agencies. The more money we raise, the more money we're going to be able to put into that state program. And with that $200, what we're finding is people are buying food and other essentials. So again, it's intended to provide immediate financial assistance, recognizing that oftentimes there's a delay before unemployment kicks in or you receive your stimulus check, etc.
Yeah, those stimulus checks went quick.
They did go quick.
Yeah.
They did go quick.
They really did. And then I saw on the news yesterday that the Democrats are pushing for like a $6,000 check. I was like, whoa, I could pay me off a credit card maybe or something. I don't know. But I mean, and we don't even know if we'll get any of that money. And we don't even know how long this whole thing is going to last.
Right.
Right. And that's the other piece of it. And John's going to speak to a great partnership that we're launching with the city of Hartford. To your point, in terms of that stimulus check has not lasted long. And then what? What do families do? So John, do you want to talk about the financial coaching program we have?
Please coach me, John. We need some help over here.
Absolutely. So one of the major pillars for United Way is economic mobility for our families and our communities. And so we're working with the city of Hartford around two initiatives, one being the financial education campaign. To your points earlier, we know that if people did their taxes, they've already gotten that money, and a lot of times that money has already been used. And the same thing with the stimulus monies. Now, from a government standpoint, there's talks about freezing rent and things of these nature. Student loans are being frozen. Some people are able to get their car loans and other bills frozen. But that's right now.
Mm-hmm.
Yeah.
Mm-hmm.
And we have to realize that that is only for a finite amount of time.
Yeah, like 90 days or something. And then you have to pay it back.
Yeah,
Yeah,
exactly.
right.
And the interest is rolling and all of these things. So a lot of times when we're in the moment and we're dealing with a challenge, like we're dealing with the pandemic that is just unprecedented. I think going back to like the 1950s was the last time we dealt with something like this, is the mindset is, let me address what I can address right now financially.
Right.
And so when that bill is out of sight, like they say, it's also out of mind. And so what we're trying to do is work with the city and give resources to residents so that they can start planning for the future, understanding that you may have this money right now, but the bills are going to be due in 90 days. So what can you do? What is the plan that you can put together? How can you save? How can you learn new strategies around saving? One of the things one of my friends always told me is after you pay your bills, you should look to see how you could pay yourself. So we are working with the Connecticut United Way. We're joint teams with what's called Trust Plus, formerly Trusted Advisors. And that's a program that pairs residents with a financial counselor. And it's tech enabled. You can either do your one-on-one sessions with your counselors through the telephone, or you can do it on Skype at whatever is your preferred method. It's available in English and Spanish, and it's designed so that you can work on a plan for your immediate goals, your goals a little bit down, and then your future goals. So when you're looking at what we're going through with bills and all of that nature, people could put together a short-term plan of, I have my check from my tax return, I have my stimulus payment, I have a little bit of extra money, more than I'm usually used to. How can I best maximize that money to make sure that I'm on stable ground for as long a period as possible? And that's working with your advisor through Trust Plus. The second one we have, and interrupt me if you have any questions about
Well, yeah, let me just ask you quickly, what's the criteria for any of this? Because I mean, what can I get in on this situation?
Absolutely.
I would love some counseling because I'm like,
it is free to residents.
Hey.
I believe 18 and older.
Because some of those credit repair places, they be hitting me up, and I'm like, oh no.
No, this is absolutely free. It's a national model. It's like I did say, it's 18 and older. And you sign up. It's a very easy sign up process. And then once you get the ball rolling, you meet with your financial advisor, and the two of you sit down and figure out what is the plan. What is your immediate goal? What is your midterm goal? And what is your long-term goal? And like I said, this is free. And this is something in times like this that can be very advantageous to the community and to the people that are not sure what the immediate future may hold for them. So it's have a solid financial plan and foundation. Now, the other one that we have, it's called Alice Saves. And so Trust Plus used to be an extension of Alice Saves. Alice Saves is a program where it's teaching you financial techniques. It's teaching you lifelong saving habits. And so the benefit of this, I tell people, at a minimum, through this program, if you could put $20 in your savings account every month for 6 months, and it has to be 6 months consecutively, you get a free $60 at the end of it. So who doesn't want free money? You know,
I do.
and it's the same thing. 18 years of age, valid email, and you have to have a valid savings account, because that's where they want to see you putting the money into, so that you can get the $60. And they do giveaways and prizes throughout the process. But these are just 2 programs that are really designed to get you in the habit of looking at your money in a different way. If you haven't developed those techniques yet, or had the opportunities to practice and sharpen those skills, to learn them and to be able to put yourself in a more solid financial standing. Now, for people that have not filed their taxes already, the government, the Connecticut Department of Revenue, has extended the filing deadline to July 15th of this year. And many of the sites and partners that we worked with, from the Village for Children and Families and HRA in New Britain, were running sites up until the pandemic hit. And so they have gone now to a virtual model for people to file their taxes. And what that encompasses is you call into 211. And for this, you have to, your income threshold is 56,000 and under to get these taxes done and prepared by a professional at no cost. So you call into 211. You tell them you're interested in the VITA program and you want to get signed up for a session and for a counselor to work with you. And they'll get you connected. You get a link. You fill out your paperwork. You send it in. And then a preparer will go through your taxes with the information that you sent over and the documents. And the list is very straightforward in terms of what they need to fill out your taxes. They'll go through, prepare taxes at no cost. And then you get a call or an email that sets up a actual walkthrough of all your paperwork to make sure everything that needs to be there and that is required by the IRS is there. And then it's as simple as signing with your finger to say, this information is correct, and it's submitted, and your taxes are
Michi,
done.
did you know about this? Because I spent like
No.
$450 to get my taxes done each
I was
time.
about to say, first off, I'm blown away. And
Mad right now.
like, this is crazy. Wow.
Yeah, and, you know, one of the things about this is sometimes people are afraid to have their taxes done because they're afraid they're going to owe money, right?
Yeah.
And oftentimes what we find is that, you know, people get paired up with a trained volunteer certified by the IRS, and they are blown away by what they find they are eligible for in terms of a refund, but also tax credits, such as the earned income tax credit.
Right.
And there are people who feel that, you know, maybe they've worked minimally and they don't think that they should file because they're below a threshold. Yes, in fact, you want to file your taxes because then you can claim the earned income tax credit. So we've been doing this for more than, you know, a dozen years, and saves people money. You have a trained tax preparer. It's volunteer driven, and we're just thrilled to be able to support this program and make it available.
I had no idea.
Me either.
I had no idea that you guys offered all these
radio shows, Jen.
Yeah, I guess I should be getting up and listening to these things, but no, honestly, I
we'll
really
do more radio shows with you.
Oh, you'll do more for me. Okay, yeah, because I really want you to keep coming on and telling me about all these free programs, because dang, I didn't know a thing about this. Michi, I know you were going to ask the next question. Go ahead.
Yeah, so, you know, with just all the people that you guys are dealing with, have you guys been seeing like a gap between Connecticut residents being hit harder by the health and financial consequences with the COVID-19?
Yeah, you know, I was going to say, you know, kind of just what I touched upon earlier, you know, let's just pause and think about all of the businesses and all of the organizations that have been closed, right?
Right.
So you think about all of those gyms and fitness centers, think about the impact on hotels, on restaurants, just about every business and industry, right? You know, you all are working from remote locations, we're working from remote locations, but there are some businesses that have just literally closed,
right?
You know, whether that's temporary or whether that is long-term. And it's hitting people really hard. And again, there's that delay before you get a stimulus check or qualify for unemployment. But, you know, to the earlier point, women and people of color are being hit disproportionately because those are the groups that tend to be working in those occupations that have been hit really hard.
Yeah.
Or to John's point, they may be, working in essential industries, but their jobs may not necessarily be paying enough. So you're forced to go to work to keep your job, and you have these extra costs because your kids are home, because you may have friends and relatives living with you. So that's what we're seeing in terms of the gaps and the residents that are being hit harder. We're also finding, and this goes to a public health education campaign we're doing with the city and our two major hospitals. In urban centers like Hartford, you have significant number of people that are living in dense housing. So you have multi-generations under one roof, a lot of strain in terms of food and utilities. You may not necessarily have transportation to get to a testing center. You may not have access to a lot of the public health protocols that many of us do. So we're finding that people in urban communities, and again, this speaks to our capital city, are being disproportionately hit.
Mm-hmm.
So our public health education campaign with the City of Hartford, Hartford Hospital, Hartford Healthcare, St. Francis Hospital, Trinity Health of New England is all around making sure that people understand what's the importance of physical distancing, the importance of wearing a face mask, proper hand hygiene, all of the ways to spread, to reduce the spread of the coronavirus, particularly in these multi-generational, large multifamily housing units.
Right. And I would even love to have some of those folks on at one point, Paula, if we can make that happen, because, I don't go out very often, but when I do, we take a little drive or whatever, and I'm finding that people don't seem to be following some sort of real protocol,
Right.
Like the other day I saw a girl, she looked a little bit younger, like with a baby, but she's got the mask on, the baby doesn't. Like I would love to know exactly what the rules are, because it seems like people are kind of just making up their own rules as they go along.
Yeah, we would love to come back and also connect with our health partners on to have them come on the show.
Yeah.
Part of our job in terms of this partnership is to make sure that we're getting the word out through the media,
right,
through community-based organizations, to faith-based organizations. Again, just really wanting folks to have this critical information, and also really wanting people to know when do you go to the emergency room, right?
Yeah.
Versus when do you call your own healthcare provider. One of the things that we found from our hospital partners is that some people that are having heart issues, right, are tending not to go to the emergency room because they're worried, they're fearful that they're going to contract something. So some people who need that emergency assistance aren't going, and that's presenting a whole other challenge. So part of this campaign is, if you're experiencing these symptoms, this is when you call the doctor. If you have these symptoms, get yourself to the emergency room.
Right. Perfect. Yeah, let's actually maybe set that up for next Sunday, if that works out for you guys, because I would love to just kind of go over what we're supposed to know with all of that.
Great.
Is that good with you? I know that something else that people are really dealing with right now is anxiety.
Yeah.
And, it's funny because when I'm on like Instagram and stuff, and me and Michi will talk about this all the time, people will be out there like, if you're not starting a new career right now, or if you're not, you're at your absolute best, blah, blah, blah. And so it makes you feel all this pressure, like, oh, I'm supposed to be doing so much during this time. But then the other day I saw somebody actually post something like, if you haven't done anything during this time, it's okay, because people are in shock. Right. That we're dealing with this, right?
Sure.
So, and I also saw another commercial the other day where on TV where they're talking about, it's okay if you feel overwhelmed right now. It's okay if you're crying in the middle of the afternoon, because that's some of the things that I'm going to say personally has been going on in my household. I got 3 daughters here, and my son who's younger, and there's a lot of confusion, it feels like, and you're trying to be on a schedule, and there's just a lot of anxiety.
Yeah, very much so. One of the things about the coronavirus is that it's affecting each and every one of us, right?
Right.
Well, just across the board. And clearly, this is a time when people are feeling anxious. You know, you may be worried about your financial situation. You may be worried about your health or the health of a loved one. You may be at your wit's end. You know, maybe you're like John, you know, where you're working intensely from home and you have these two children that also want your attention, let
Yeah.
alone your partner. So we want folks to know a couple things, right? First of all, it's understandable. It's okay if you have these feelings, right? Second, there are resources available to you at no cost. So one of the best things for people to do if they're feeling anxious, if they need some help, is to pick up the phone and punch in 211. So anywhere in the state of Connecticut, you can call 211 24 hours a day, 7 days a week, in any language. There are people there to answer the phone on 24 hours a day, 7 days a week. They'll listen to what you have to say and connect you with the right resources. So that's the basic. And even if you need help with financial assistance, anything, Health and Human Services, call 211. The other piece that we want to hold up is that 211, which is a service of United Way statewide, has been partnering with the state of Connecticut on a program called Talk It Out. So Talk It Out. And actually the website is talkitoutct.com. There's a phone number people can call. You will be connected to a trained professional, and it's someone who's going to listen, who's going to understand, who's going to help you talk it out, and who's going to get you connected to resources. So, you know, you think about parents and caregivers, it's a good time to reach out, you know.
I think I saw actual commercial for that on TV where the guy had a baby or whatever, and they said, you know, he was a little frustrated. So they said to walk away and call the phone number. I really liked that commercial. It was good.
Yeah, just some basic things that people can do.
Yeah.
We also have a few community partners that this is an area that they specialize in terms of counseling and behavioral health. So we do want folks to know, John mentioned before, the Village for Families and Children that helps with a lot of financial programs. They also provide information. It's a free, new, non-emergency information line where people can call and speak to one of the psychologists at the Village for Families and Children. Going to answer questions and connect you to other resources if you need to. And so we have that number, and that may also be an interesting show in the future too.
Okay.
I think the thing for people to know, however, is it's normal, it's understandable. This is a time of high stress. Please remember, call 211 to get connected, or you can go directly to the talkitoutct.com site.
And Jenny, I want to add to that a lot of times in communities of color, even outside of this COVID and the pandemic and this situation that we're dealing with, there's also a lot of times this hesitancy around mental health, around seeking counseling, around, you know, feeling that if I ask for help, that it's a sign of weakness. And it really isn't. It's one of those things that as a community, Black and Latino communities and people of color, that we need to start having this dialogue. And this is a conversation for another time, but I just really wanted to point it out that it is okay to reach out and get help. Mm-hmm. It is okay to pick up the phone and call 211 and say, listen, I'm having a really tough time, or going to Talk It Out CT, or calling 833-258-5011 to get the assistance that you need. And as a community, it's something we really need to start looking at, and moving beyond that stigma of counseling and mental health is not something that we talk about or anything that we need to address.
I agree. I think that people need to be open-minded about, you know, mental health, and it's a very big issue.
Mm-hmm.
Absolutely.
It really is. So if folks want to get involved, they want to help donate, they want to, you know, just get some information, where do we go?
Just go to our website. It's unitedwayinc.org. So unitedwayinc.org. And right there, Meech talked about this, right there on the homepage, you're going to see 3 buttons, right? Give help, get help, and resources. And we would love to hear from people. We always want to make sure that our resources are up to date and relevant. So get in touch. That would be great.
Thank you so much. This was awesome. I learned so much today, Meech. What about you?
I definitely did.
I did not know that there were all these cool, like, free services and everything. I had no idea.
Amazing, amazing.
Yeah.
Well, we have very generous individual donors and very generous foundations and corporations. And again, just encourage people, go to unitedwayinc.org to get help, to give help, and to get connected to resources.
Well, thank you so much, Paula Esgalberto and John Prescott.
Thank
I
you
really
for having
appreciate
us.
you guys from the United Way today. It's Hot 937.
Thank you.
All right, so listen, that's all done, and I'm going to package it. We're going to send it to you. Either we're going to use the video or we're just going to do the audio. Michi's just got to